Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what are the available knee injections for arthritis? Knee arthritis affects over 40 million Americans, and it is the leading cause of disability in the United States, according to the CDC. More women than men suffer from arthritis. In fact, it's actually 20% more. And the total cost for arthritis treatment exceed $100 billion annually in the United States. Between the years 2000 and 2010, the number of knee replacements in the United States actually doubled to almost 600,000. By 2030, it is estimated that demand could reach about 3.5 million knee replacements. And interestingly enough, 35% of those occur in people aged 50 to 69, which means that a lot of people will end up needing a knee revision of that knee replacement. So a knee replacement is a quality of life procedure. It's elective. You don't have to have it. Knee arthritis never killed anybody. So it should only be performed after considerable conservative treatments are received, and these may include such things as nonsteroidal anti-inflammatories, Tylenol, prescription pain medications for when the knee arthritis is severe. Topical pain medications work very well for knee arthritis, and these may include creams or gels of nonsteroidal anti-inflammatories, lidocaine patch, capsaicin, things like that. Physical therapy can be very beneficial for taking stress off of the knee by strengthening up the muscles around the knee. And there's also bracing, and this may include functional bracing, unloader bracing. So knee injections play a vital role in the nonoperative treatment of arthritis, and they can help often delay or avoid the need for a knee replacement. And in a person who's younger, like in their 50s and 60s, this can be very helpful because, keep in mind, knee replacements are not meant to last forever. So injection opportunities include cortisone, which is corticosteroid, or often just called steroid injections, hyaluronic acid, and then the regenerative medicine injections, such as with PRP, which is platelet-rich plasma, BMAC, which is bone marrow aspirate. There's also fat-derived stem cell injections and amniotic-derived. So we're going to go through these. Cortisone injections have been performed since the 1950s. They've been a mainstay of knee arthritis treatment. Initially, they were performed for rheumatoid arthritis, and they worked really, really, really well. So a few decades later, they started spanning over into degenerative osteoarthritis, which is normal wear and tear osteoarthritis. They don't cure anything. That's not the purpose of steroid injections. And it is questionable if they actually do any harm to cartilage. It looks like they don't, but it's not definitive. And numerous studies have been done on knee injections with cortisone and showed that 75% achieve good to excellent results, and it may be for weeks to months at a time, and then they can be repeated every few months. Currently, they are the gold standard for knee arthritis. Hyaluronic acid injections are also known as viscosupplementation. Hyaluronic acid is the, quote, motor oil that's normally found in the synovial fluid of joints. In 1997, the FDA approved the first HA preparation made from rooster combs. And it showed that it didn't cause any adverse events in the knee. Numerous trade names are now available for these HA preparations called Hyalgan, Synvisc, which you see pictured, and Orthovisc. And they've been studied against each other, and neither product, none of them have shown superiority over the others. One of the largest studies performed on HA injections in the U.S. showed that beneficial effects occurred in 80% of patients for over 6 months. So very effective. There was also another study looking at these which showed that at 1 year, 65% of patients still had pain relief from the HA injections. But the theory is that they provide lubrication just like normal HA does. They have an anti-inflammatory effect, and they also compel the knee to produce more cartilage. That's theory. It has not been proven that that actually happens. PRP therapy involves platelet-rich plasma therapy. It's a simple blood draw in the office. The blood is then put into a centrifuge machine and spun around quickly for 15 minutes, and it turns it into concentrated platelets and growth factors. That is then immediately injected into the problematic area, in this case the knee, and it may be that 1 to 3 injections are necessary over a period of a few months to receive the best benefit. Now, multiple studies have looked at PRP therapy for the knee. One of them showed 70% good to excellent results at 6 months, and one out of the Hospital for Special Surgery actually looked at MRIs over the period of a year. And they showed that in 70% of patients, there was preservation of the cartilage, as you could see on an MRI, which is very effective. I mean, we know that steroids provide pain relief, but they don't do anything beneficial for the cartilage. If PRP therapy can help maintain the cartilage, then that's a big, big win. Now, then we move into stem cell injections. PRP therapy is sometimes called a stem cell injection, but actually what it does is the concentrated platelets and the growth factors actually call in stem cells from the body. What stem cell injections themselves do is they actually take the body stem cells or from amniotic fluid and place it directly into the knee to help regrow the cartilage. So we have the potential here to alter the course of arthritis and not just to mask the pain like cortisone does. So there are bone marrow derived stem cell injections, which involves harvesting bone marrow from the iliac crest, and then in the same procedure they process the bone marrow, concentrate the stem cells, and then inject them into the knee. Fat derived involves taking some fat, processing it, and injecting that. Amniotic derived stem cell injections are processed through an FDA regulated lab. Essentially what happens is amniotic fluid is taken from consenting donors, and it's then processed to make sure it's clean of infection and any transmissible diseases, and then it's used in the knee. These are all mesenchymal stem cells. They are not embryonic. There's no ethical concerns from using these products. So in looking at these for knee cartilage defects, there was one study recently that showed 6 months after transplantation with the stem cells, the patient's clinical symptoms had improved, and the improvements were maintained over longer follow-up periods, over a year. And that was only in 9 patients, but it's something. There's been no large clinical studies in humans to prove efficacy of these stem cell injections, but there's been lots of small studies and anecdotal case reports. So the bottom line is that there are various types of knee injections available. All of them are low risk and outpatient, and in combination with other treatments that are available, they may help delay or avoid the need for knee replacement. And all of them can be repeated every 3 to 6 months as needed. The top pain clinics in Arizona are Arizona Pain Specialists. They have board-certified, award-winning pain management doctors who offer comprehensive non-operative treatments, including pain management, chiropractic, physical therapy, acupuncture, which includes both medical and interventional treatments. There are 5 clinic locations accepting over 50 insurances and offering over 25 different treatment options. The phone number to call is 602-507-6550, and the website to visit is ArizonaPainNetwork.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.